My name's Anita Hazari. I'm a consultant plastic surgeon working at the Ashford Hospital. I perform upper blepharoplasty, or also known as upper eyelid reduction, under local anaesthetic, and I offer this surgery here at Ashford Hospital. So blepharoplasty is eyelid reduction. Upper blepharoplasty is when excess skin from the upper eyelid is taken away, or also called upper eyelid reduction. And often the ladies who come to me requesting for upper eyelid reduction will have the skin loose enough such that it reaches the eyelash margin. So often there's actually no point even trying to wear any eye makeup because it's just not seen. Men come for this operation too because when they're driving, when they look over the shoulder, they miss the blind spot because the eyelid skin has started to hood over the upper eye and they cannot visualize oncoming traffic as they are trying to switch lanes. So this surgery is performed under local anaesthetic on an outpatient basis. So you come as if you have come for your outpatient. We have a minor surgery centre here. I will give local anaesthetic into the upper eyelid after making a decision how much needs to be taken away. And you have to keep your eyes closed throughout the operation. There are some very bright lights on as well. The excess skin is taken away, and sometimes a tiny bit of fat, if required, is also removed. Once all that is done, you may hear a buzzing noise. That's just me cauterizing the tiny bit of bleeding that might be occurring. At the end of the operation, the wound is sutured. It's usually a non-dissolving suture, which is inserted at one end of the incision, woven under the skin, so you can't see it on the outside, and then comes out at the other end of the incision. Once it's all been sutured, you have some dressings, and you have to keep all of this intact for a week. You're also given sometimes drops to keep your eyes lubricated, especially if you suffer from dry eyes. So sutures usually are removed at a week after surgery, so it's prudent to try and have no social engagements for the first week to 10 days because you're going to get an awful lot of bruising, and you may even look as if you have been in a round with a boxer, because sometimes the bruising ends up going onto the lower eyelids as well because the skin around the eyes is very fragile. A week later, once I've removed the sutures, you may also feel that there's some tightness in the upper eyelids, but that sort of starts to relax as the swelling starts to reduce as well. You're able to wear makeup on the upper eyelids 3 to 4 weeks onwards. And in terms of driving, you can usually drive a week later after the sutures have been removed. And in terms of going back to work, well, if you're doing online work, you may wish to treat yourself for the first few days off, and once the stitches are out, you can go back to work in a sedentary job. Any job that requires very heavy lifting, it's probably a good idea to take about 10 days to 2 weeks off, because one wants to refrain from bending down too much where the head is below the level of the heart. The main issue is bruising after the surgery, which takes a couple of weeks to go down, and swelling, where the mild puffiness may remain for up to a month or so. As far as complications are concerned, you will have tightness after the surgery, which will relax, and similar to other operations, you can have a bit of bleeding, hematoma, which is a collection of blood under the skin, and if that happens and doesn't resolve, it may sometimes need removing. Infection generally is unusual in the upper eyelids because it's a very vascular area, which means there's a lot of blood supply to that area. In the assessment for the surgery, it is important to also provide to the surgeon your latest eye test results. And the reason why this is required is to see what your intraocular pressure is, which means the pressure inside the globe, which dictates whether you have glaucoma or whether you are predisposed to a glaucoma. This is important because sometimes after this operation, if there is a little bit of redness in the eye, steroid drops may have to be used, and that can precipitate glaucoma. If you're considering upper eyelid surgery, by all means come and make an appointment to see me and get assessed at the Ashford Hospital. We offer this surgery under local anaesthetic on an outpatient basis, which means you are awake during the operation and you get to go home the same day.